Good morning, everyone. Welcome to class this morning, and welcome to Module 15D. Here we'll be discussing about wound care and wound dressing. Technically, wound care and wound dressing are not so different from each other, and they go hand in hand. First of all, before we know how to care for a wound, we must first know what a wound is. Of course, we know a wound is a breakdown or an injury inflicted upon a body, a part of the body. It can be external, it can be internal. Now, when we talk about external injuries, there's the ones you can see maybe on the skin, that things that are visible that you can see. Those are external kind of injuries or wound. Then internal wounds are the ones inflicted internally that you cannot see, but then the pain can be felt within. The most time we may not be able, we're talking about wound care and wound dressing now, we may not be able to dress an internal wounds, but there are ways to protect or rather to care for an internal wound. So different from an external wound. So wound generally means what? Harm, breakdown of a particular body part, or a harm inflicted on a body. So then without wasting much time, we'll go to what our module has to tell us about what wound is. So in this content, we'll be talking about an introduction. Of course, we introduce ourselves to the topic proper. We define what wound is, wound dressing, and wound care. We'll go through the general instructions guiding wound care and wound dressing. We talk about the preparation of articles, what are the things we prepare for wound dressing, and we talk about preparation of our patients and even the kind of environment we do this dressing. Then we're going to discuss about the procedure itself. How is it done? There is always a technical know-how in performing most of these conditions because you must be taught on how to do a wound dressing. If you don't know and you don't follow the due process or the due procedure, you end up discovering that it is either you cause more harm than good, or you infect the injury, or so many things are liable to occur. Then we have an aftercare, which we also discuss. The aftercare means after a wound dressing, after an injury occurs, fine, we've taken care of the wound, we've dressed the wound. What do we do next? That's the aftercare. And then, of course, we know in any of this profession, being a home health aide, being a caregiver, being a nurse, whatever practitioner you are, when you perform a procedure, it is only right that you document, because if you do not document, it is same as you've not done anything. So these are the major contents we'll be discussing about in this chapter. So let's move to the first part of the first content of this chapter, which is definition. Of course, we've been able to introduce ourselves to this topic, and I was able to tell us that wound dressing means what we are able to define what a wound is. And I said wound is a breakdown on the skin, or when an injury is inflicted upon a body part, either internally or externally. That is injury, that is wound. So it may not be visible to the physical eye, and it may also be visible. So when it's visible, I said it is what? External. And when it is not visible, I said this is what? Internal. So now let's define what dressing is. Now, dressing, from the word dress, we know that dress is to put on clothes to cover the body's nakedness. Now, I'm going somewhere. When we're not talking about wound dressing, before we read what we have on the screen, when we are trying to dress a wound, it means we are trying to cover the wound. Imagine the wound is naked. Now we are trying to cover the wound. Why are we covering the wound? So as to reduce the exposure to further harm or external factors that could precipitate or cause injury, further injury, or even infection on the wound. So a dressing is a sterile pad. Now, what by sterile pad is it must be a clean pad, not just a sterile pad. or a compress that is applied to a wound to promote what? Healing and protect the wound from further harm. Now, healing process does not occur if the injury is not sterile. Now, what do I mean? Imagine that say you have an injury. There's this mentality we do have them when we're young. That when you have injury, we pour sand, and the sand will get attached to the wound. That is a very bad culture. A very very bad culture. Deaths are not supposed to be on wound. Wounds are meant to be sterile. Why? Because infection setting on if an infection sets into a wound, number one, healing process will be maximally reduced or even inhibited. You won't heal, there won't be healing process. Then there's going to be breakdown of that injury. And of course, when there's breakdown, it is what increasing further harm. So dressing is to be used to have a direct contact with a wound, but bandage is used to hold a dressing in place. So here we have two things: the dressing itself and the bandage. And the dressing is a sterile part. In most, if you go to a hospital, in a hospital setting, we use a sterile gauze. We sterilize the gauze. We use you wear your gloves. We still write the procedure when we get there. But just a little talk on it. You wear your gloves. Your gloves are clean and sterile. Your hands are sterile. You have an assistant because you can't touch clean and unclean thing at the same time while making a sterile dressing. It's not possible. So you have to be completely sterile. Having taking precautions of or taking note of every uh, little thing that can contaminate the injury. So when you put a sterile pad that is addressed on the injury. Let's assume I have an injury on my hand. When I put the sterile pad on the injury, I have to hold it in place. Imagine me putting a pad and just stringing my it's going to fall off, of course. So we use a bandage to hold it in place. That is what dressing means. Now we have types of wound. Wound that is when we talk about wound wound dressing, of course, it's an injury. We have the skin wound, the one that is just a normal, maybe laceration, a cut, abrasion, whatever it is on the skin. Then we have skin infection. Now, there's some skin infection that results to skin lesion. Let's assume that some people who have this something called maybe boil, or we call it cellulitis sometimes, in medicals. Now, things like that is an infection on the skin, which could cause further breakdown of the skin, resulting to a large injury that could even be, that could spread wide. So those kind of injury are not to be taken lightly. They are addressed daily with concurrent antibiotics, so as to what? Make sure the injury heals up. And also, of course, it is an infection that caused the injury. So you cannot take chances of allowing the injury to get reinfected again. And finally, we have the antimicrobial wound dressing. So now there are some type of wound dressing that are called antimicrobial wound dressing. Here, in wound dressing we use a lot of things. The major equipment we use for wound dressing is normal saline and maybe povidone with you clean with normal saline or you wash with Savlon. Then the other thing you can use for wound dressing, that wound dressing that involve you using hydrogen peroxide. Maybe let's say a wound that has pulse, a wound that is deep. You can't just clean, and you have to use something to like hydrogen peroxide is a potent wound, a potent factor in some kind of wound dressing. Then sometimes we use antibiotics during wound dressing. Most especially during skin infection, it's a type of dressing that has to do with skin infection. We use antibiotics to clean. We use antibiotics to wash. Then sometimes there's some injury that are so deep that it needs to granulate out. We use honey most times. Sometimes we use Uzol. They call it Uzol. It has a full meaning. I'm trying to remember the full meaning. Maybe when I do, I'll just say it. I think it's European Union, European University Solution of Line. So European University Solution of Line. So that's quite particular and just acts like honey. Honey also helps an injury to granulate faster, and so that one and also prevents microbes from infecting the injury. So that also doesn't function. But that one is not like honey is a local sense, while Isol is a medical or let's say an international sense. How would I put it? I hope you understand. So now let's move to the general instructions in practice of what of wound dressing. The general instructions. We have quite a number of instructions. Now, what are instructions? We know instructions are things, they are guidelines, they are precepts we have to follow. If you don't follow it, that means you are making blunders. Now, because of the malpractice is a serious crime in health. Now, malpractice is not just, in the exam when you say malpractice, you are cheating. Of course, it happens also in health. Now, if you are doing a procedure or you are doing the right thing. Of course, you are doing the right thing, but you are doing it wrong. That is malpractice. Anything that does not conform to the original standard is a malpractice. So anything that does not conform to the original standard is a malpractice. So we have to be careful that when performing wound dressing, when doing these kinds of procedures, we have to keep what strict aseptic techniques. So the first guideline here is practice strict aseptic techniques to prevent what cross infection to the wound and from the wound. Now imagine you sorry, taking care of a wound. I won't really be the points are explanatory, so I will only pick on points that needs to be efficiently explained. So we have more time to explain the procedure and within the time frame we have. So, but first thing is to practice strict aseptic. What's aseptic technique? Aseptic, a that in medics when you hear a means lack of, then sepsis means infection. So aseptic technique means that what a technique that is void of what infection, any kind of infection, any kind of bacteria. So you practice strict aseptic techniques to prevent cross infection to the wound and from the wound. Then all particles should be disinfected thoroughly. All articles should be disinfected thoroughly to make sure that they are free from what? From pathogens. In most cases, disinfection can come through maybe autoclaving, boiling, depending on the instrument, or we can even do carbonize. But the simplest one we do is to carbonize instruments, where we wash the instrument with antiseptic like Savlon, and then we rinse with spirit, just to make sure that they are free from what pathogens. Then you wash your hands thoroughly before the procedure and after the procedure. Of course, before the procedure, it is very important to wash your hand before the procedure. Then after the procedure too, you have to wash your hand, because you may be taking care of two patients at the same time. Now after touching, even forgetting about now, fine, ourselves is important that if you not wash your hand, you may even get yourself infected. But now let's even see that, let's even assume we have two patients now. After taking care of one patient, you move to the other patient without washing your hand. You can transfer infection from the surrounding. The patient may not be on the patient's injury, it may be at the surrounding surfaces or the skin of the patient. You transferring that infection now to the next patient. That is cross infection, which we said in our point one that we should maintain strict techniques to prevent what the wound from getting cross infected from one wound to the other. Now, instruments should be used. Instruments that are used for dressing cannot be used for another until they are being sterilized. You have 10 patients and you want to quickly do your wound. So you want to quickly do your wound dressing, and you picked up, fine, you have your instruments, you have only one set of instruments. And after you feel like, okay, you don't have the time to re-sterilize the instrument, so you just use the instrument from one patient to the other. That is outrightly wrong. Number one, you have committed a huge offense called malpractice. Number two, you have successfully distributed infections to all your patients. So instruments that you have used for one dressing cannot be reused immediately for another person unless you re-sterilize it. Now, it is safer to sterilize instruments than to carbolize them. I told you what carbolization means already. So some instruments can be boiled. Only instruments that know that you don't want to boil them because of risk of getting blunt is maybe scissors or those sharps. And those sharps, you use scissors less during wound dressing, maybe just to cut sterile gauze. So those ones can be, if you don't have autoclave, you may not be able to afford an autoclave, but at least you can use red heat. There are many ways we can sterilize instruments. We have the red heat. We have the one that you can just use a flame of fire to burn. So it's not like that. Like maybe let's say the scissors and this, so you can just use a flame of fire to burn the mouse and carbolize the instrument. Just make sure that the instrument is sterile, aseptic. Our goal is that the patient should not be infected. Then you use face mask, your sterile gloves, your gown for if you are doing a large dressing to minimize the wound contamination. Most time we wear gown, our shirts shouldn't come in contact or interfere with our wound dressing. Now, during wound dressing, you go close to the patient, you go far from the patient, you turn, maybe trying to get a good posture. By so doing, your clothes, the dust on your clothes, there's some microbiome, the dust may get, on the injury. So that's why we use a gown, sterile gowns. So these gowns are sterile and they create a barrier between your own body and the injury of the patient. Then use dressings are not to be, so dressings are not to be changed for at least 15 minutes after the room has been swept or cleaned. When you clean the room or sweep the room, do not do dressing immediately. At least 15 to 20 minutes later, yes, wood dressing can be done. Why? Because when you sweep, particles are flying in the air. So it takes a number of time for them to settle down. So until they completely settle down, you don't do wound dressing. Because when you expose the wound, fine, you are keeping a certain technique, your hands are clean, your gloves are clean, but is the air in the room clean? Because of an air current. The moment they sweep, the air becomes charged with microorganisms in the air. So if you don't allow those microbes to either settle down or get completely, of course, you must try to keep your hands clean, keep your body clean, use your gown, keep to the other, procedures, guidelines. But just this one has made your procedure, has made the wound dressing was a good rubbish. So we have to be careful that you don't sweep before. Sorry, you allow a number of minutes to pass by before opening the dressing or changing the dressing after the room has been cleaned or swept. Then use individually wrapped sterile dressings and equipment for the great safety of the wound. Now we have sterile packages. You can't sterilize instruments. Now it has been made easy. Sterile dressings are sold. You can buy a
undebatable truth. Community and social support. Christian community provides a vital network of support, encouragement, and practical assistance. Social connection is also a crucial element of mental well-being, combating feelings of isolation and loneliness that can exacerbate despair.
Sorry, I was logged out for a moment. I'm trying to share my screen again. All right, so sorry for the break. It was a glitch in network, I suppose. So I think I don't know. So I was talking about dressings. Okay, yes, you said using individualized steroid dressings and equipment for the greater safety of the wound. And I've explained that already. So say create a steroid feed around the wound by spreading a steroid towel. So don't just open the wound. Before we open the wound, we clean around the wound, then we place a steroid towels. These things are also being sold. We call them yeah, that's the name towels. Some call them sterile drapes. Some call them sterile drapes. So you avoid talking or coughing and sneezing when you are doing when the wound is open. Then during the procedure, the nurse works carefully to avoid contaminating the patient's skin or the patient's clothing, the bed linen with soiled instrument and dressing. You also to clean the wound. When cleaning the wound, it should be done from the cleanest area to the less clean area. Remember, when you are dressing a wound, we dress from inside to outside. This is a wound. A wound is this wide. Don't clean this way. I wash my hand carefully. A wound is this wide. Don't. Sorry about the glitch. Sorry for the glitch. I was locked out. I was trying to log in again. I don't know. So I don't really know where the network really cut us off, but I think I'll just continue from where I can be so sure that we had a we had our last discussion. So I can remember we I think the network issue started at number 7, and we said you should use individually wrapped sterile dressing and equipment for the greatest safety of the wound, and I've been able to explain that already. Okay, so I'll move to the next one, number 8. So you create a sterile field around the wound by spreading sterile towels. Now, when we open, it's only wise that when we open and before we open an injury, when you open injury, you clean around the injury and you place around that injury a sterile towel, not just to expose the wound anyhow. Then avoid talking, coughing, or sneezing when the wound is open. That's a bad culture. So avoid coughing, talking, or sneezing when the wound is open. Then during the procedure, the nurse works carefully to avoid contaminating the patient's skin or the patient's clothing and bed linen with soiled instruments and dressing. Then when you are cleaning the wound, the cleaning should be done from the cleanest area to the less clean area. Now I was saying that if you have imagine you have an injury like this, you don't clean from outside to inside. Instead, you clean from inside to what? To outside. So cleaning the wound should be done from the cleanest area to the less clean area. You consider the wound area cleaner than the skin area, even if the wound is infected. So therefore, you clean the wound from the center to the what? To the peripheral. And if the dressings are adherent to the wound due to the drying of the secretions or blood, wet it with physiologic saline before it is removed from the wound. If you're opening a dressing, sometimes the dressings can be dry. You wet it. I told you we are dressing with saline. I'm not using pure water or bottled water here. It's normal saline. It's sterile water. Just saline. So you can use to wet the injury before removing the dressings. Then when dressing the wound, you can um, keep the wound edges as near as possible to promote healing. So you try to it won't let's say there's a cut. That is why most times the wounds are sutured to bring the edges together. So you keep the wound edges as nearer together as possible to promote what wound healing. Then when drains are in place, you anticipate drainage and reinforce the dressing accordingly. The dressings over the drains should not be combined with the dressings on the wound line. Then the amount of discharge from the wound should be accurately measured by recording the number and size of the dressing changed. Note that note the color, the odor, and the amount and consistency of the drainage. That is, the wound is what the wound is draining. Then 16, when the wound drainage is diminished, the drains have to be what? Has to be shortened. So this should be done in consultation with a doctor. Usually the doctor gives a written order on this. So before doing the dressing, you inspect the wound for any complications such as maybe dehiscence or evisceration. If present, you can report immediately to the surgeon and immediately steps are to be taken. So you avoid meal timings and you give an analgesic prior to the painful dressing. Some dressings are very painful. So all these things that we should keep in check. If you are doing a dressing and it's not healing up, there is breakdown, there is pause, there is this. No, of course, you know that definitely action should be taken immediately. So those are the ones. Then you avoid meal timings. You don't come and dress a patient when the patient wants to eat. Uh, then give an analgesic that's pain for pain. So you help them relieve pain. So let's look at the preliminary assessment. Preliminary assessment. Now, you check the diagnosis and the general condition of the patient before beginning a wound dressing. Check diagnosis. A patient you want to dress, you don't know what's up about the patient's dressing. That's absolutely wrong. Check the diagnosis and the general condition of the patient before you start your wound dressing. You can check the purpose for which the dressing is to be done. Then you check the condition of the wound, the type of the wound, type of suturing that is applied, the type of dressings to be applied, and other things. You have to look for all this before you start the dressing. You know everything. Then you check the physician's order or what type of dressing. Some dressings are to be done with specific instructions. Now, like regarding the cleaning solution, removal of suture, maybe the drains and the application of medication. So some wounds are to be dressed with normal saline, just the normal saline dressing. Some are to be dressed with some special equipment, maybe honey and the likes as well. So we have to know this before we start the dressing. Then you check the patient name, the patient bed number, and other things that you can use to identify the patient. You check the nurse's record to find out the general condition of the wound. So you know, okay, when you may not be the first person to dress that wound. So from when the patient had the wound and till now that you are doing the dressing, has there been possible improvement or there is breakdown? So we know the progress of the wound. How progressive is the injury? What has been done, and how has what has been done been beneficial to that patient? Then you check the abilities and limitations of the patient as well. So can if the patient has an injury on the hand, can he lift the hand? Can he turn the hand? What impact has this injury made on him or her? You check the consciousness of the patient and the ability to follow instructions. Then you check the articles available in the units before you start what your dressing. Now, how do we prepare our articles for dressing? Preparation of articles for dressing. Here we have the articles needed is a sterile tray containing your artery forceps, like one artery forceps. Why do we need artery forceps? Purpose is to clean the wound. Then we need a dissecting forceps, two of them. And the purpose is what? To clean or to hold the gauze piece or to scratch dead tissue from the injury. We may not know this instrument, but we can browse about them and see what the instrument looks like. Then we have scissors. The purpose is for debridement of the wound, and if necessarily, sometimes some things that need to be cut, or like maybe the gauze that needs to be cut, or let's say uh, you want to cut around, to fix in the drainage tube and etc. Many things you can use scissors for, to cut the gauze, maybe to cut even dead tissues of the skin. Then we have the sinus forceps, one sinus forceps. The sinus forceps here is to open the sinus tract or to pack the sinus tract if necessary. Then we have a probe. The purpose of the probe is to open the sinus tract or to pack this. Okay, sorry. Yes, to open the sinus tract or to pack the sinus tract if necessary too. Then we have a small bowl, one small bowl, and the purpose is to take the cleaning solutions. Then again, we have the safety pin. Safety pin is probably like one safety pin is okay, and the reason is to fix the drain in case the drains are cut short. Then we have gloves, we have masks, we have gowns. All these are also needed in preparation of what is sterile dressing, and the purpose is to use them during a large kinds of wound dressing. So your gloves, your mask, your gown. And I told us the importance of masks and gowns. You don't sneeze on an injury, or you don't sneeze in an injury. Even if it is not cultured to talk while doing a wound dressing, because mistakenly you can spit your saliva may come out and touch the injury, can cause infection. We know there's something called normal floras. In your mouth, they may not be effective, but when you get to another field entirely, they can become effective. So the normal floras in your mouth, some microorganisms are in your mouth that doesn't affect you. When they touch an injury, they become what? They become infective. So we use our gloves, protect your hands, your mask, protect your nose, and what? Your gown, protect your body. And we have cotton balls, we have gauze, we have pads, and these ones are used to what? To dress and clean the wound. Then we have the slits or the dressing towels that we use to cover the wound area, the surrounding of the wound. And here are pictorial representation of the things we need. So we can just browse. Most of these instruments are not really hard to know, though there are a lot of instruments and we may not know all their names. But the major ones we use for wound dressings, like the scissors, the sponge holder, the artery dissecting forceps, the plunge, the probe, all those things, we can easily browse them, look at them, see them far as in up close, so we understand, because there is no point in you doing using an instrument you can't identify. So first, I would say I wouldn't call that first, but an important part of wound dressing is that for a nurse, for a caregiver, is to identify your equipment. So you will not see actually first step and you will call it Babcock. You understand? So also that others are basic dressing kits. That's also basic dressing kits. So here we have the actual forceps, like the actual forceps that all some other people call them hemostat. So they are used to what, to clip. Some call them mosquito artery. We have mosquito done that are very small. We have big artery, just clamp blood vessels and use them during wound dressing as well. So we have dissecting forceps. We have the tooth dissecting, the one that has a tooth like this, and we have the non-tooth dissecting forceps as well. Then we have needle holder, we have the scalpel, we have the blade, we have the kidney dishes, we have the gallipots. So and the blades comes in different sizes. So like if you look at it, size number 10, here the blade with a curved belly being sharp edge used in making skin incisions. Of course, blades are used to make incisions. So most times the incisions you use number 10, sorry, this one, the size here, the actual size most times is 22. The first one, that number 10, the actual size is sometimes 22. The number 11, yes, we have one that the size is 11 too. So they come in different sizes, yeah. They are like the big, how big they are, their shape, curvature, or different things. If you look at the last one, that number 12 now, it's used to remove sutures. You get, so because that's a sharp and you can use to picture and cut sutures, so it's very easy. But in place of that, we can also use the number 11 to remove sutures, but the most ideal is number 12. So all these are just instruments that are used for wound dressing. So now we've talked about the tray, the sterile tray that contains the sterile equipment. So why we say an unsterile tray? Now, an unsterile tray here doesn't mean that the tray is not clean. A clean tray, but not necessarily sterile. A clean tray, but not necessarily what? Sterile. Now, an unsterile tray containing cleaning solutions as necessary, and the purpose is to clean the wound and the surrounding skin area, ointments and powders as ordered, and the purpose is to apply them on the wound. Then the Vaseline gauze in sterile containers. Purpose is to prevent the dressing adhering to the wound. Good. Then we have the ribbon gauze in a sterile container. Some things are put in a sterile container and put in the clean tray. I wouldn't want to call it unsterile, so that you not create the mentality of a dirty. Now, you don't create this kind of dirty picture in their mind. It is not sterile because we are not maintaining 100% sterility, but then these things are clean. You understand? So we have the swab sticks in a sterile container, and also to apply medication if necessary. We have the transfer faucet in a sterile container, and also to what? To handle the sterile supply, we have the band-aid, the binders, the pin, adhesive plasters, the scissors, of course. You know what these things are used for? To fix the dressing and make them stay in place. We have a large bowl with disinfectant solution, and purpose is to discharge the used instrument. We have the kidney tray and paper bag. The purpose is to collect waste. Then we have the Macintosh and towel. The purpose is to protect the bed with the linen and the patient clothes from getting soiled. So here are the unsterile or the clean tray articles. Here we have hydrogen peroxide. To zoom them, we have normal saline, We have povidone, iodine, we have Bactorob, we have tincture. And most times tincture, now we have maybe some of you may have a question, I don't know. No one is currently still with us, but they may want to ask that what is the difference between povidone, iodine, and tincture iodine? Or maybe I don't know if that would ring a bell in our mind. But then we know what hydrogen peroxide is for. They are disinfectants. When you put them on injury, it begins to foam, begins to wash the injury, each them of every bacteria. That's we know what normal saline is. We know what povidone iodine. Most times they are not so hot like the tincture. So there are places you cannot use tincture. Tinctures are really very hot, though it causes the injury to dry up fast. But then there are places you are limited to using a tincture. You can use tincture on a perineal area, on a perineal wound, or a abdominal wound, maybe around the perineum or the bottom, those kind of areas. You can't use them, right, because they can cause irritation, they can cause burn, serious burn. I hope you understand. So povidone is still the safest, at least it is active, prevents bleeding, and also prevents what uh infection from you know getting into the injury, from contaminating from injury. Then there is the sterile gauze, we have the scissors, we have the tape, plaster, different things that we use for wound dress. All these things are the one that will be in the what unsterile tray, or I call them the clean tray. Now, here is a dressing trolley. The trolleys always have two major uh two major steps. The upper step or the level and the lower level. Every sterile materials are to be placed in the upper shelf. Every sterile material has to be placed in the upper shelf. While other unsterile, now unsterile I mean other clean materials that are not necessarily sterile that can be placed under in the lower shelf. Then we have a waste bin to collect our waste. Then we look at this now. We have those receivers for what collecting used saline. When you make a saline and you are done, you just don't just litter the ground. You put them in the receiver where they can be discarded finally. Now, other dressing solutions and ointments include Izole. I mentioned of this when we started. Izole means what? The Edinburgh University solution of lime. Edinburgh University solution of lime. Yeah, not European. Thank you for that. So, the Edinburgh University solution of what? It's a solution of lime. Uh, it helps the injury to granulate from inside out. Then we have okay. It contains 1.25 gram of boric acid and 1.25 gram of bleaching powder and sterile water, up to 100 ml. Now, this thing releases a nascent fluorine and becomes useless maybe after 24 hours. Of course, what we use them for is to separate slough from infected wounds, ulcers, dead sores, and burn wounds, so that the wound can easily or hastily what granulate. So when sloughs, you know what sloughs are? When those sloughs are in an injury, the injury will not heal up fast. So acidic in pH, that is all these contents to the acidic in pH. That was pH potential hydrogen, that's the acidity, yes. So therefore they are used in wounds infected with what? Pseudomonas bacteria. Now preparation of a patient and the patient environment for wound dressing. Preparation of a patient and the environment for wound dressing. The first thing is to identify the patient and explain the procedure to win the confidence and cooperation of the patient. You explain the sequence of the procedure and tell the patient how he can cooperate in the procedure. Then provide privacy with curtains and drapes. Apply restraints, and in case of children, you apply restraints so they won't fall. Then, as far as possible, avoid meal timings. The dressings may be done either 1 hour before the meal or 1 hour after the meal. Then offer bedpan or urinal prior to dressing in case the patient wants to ease mass, so that we will not be doing dressing and the patient say they want to go and ease themselves. Then give some analgesic if the patient is in pain before the dressing can be done. For example, before dressing an extensive burn, you can give analgesic. And you can see that the cleaning of the room is done at least 1 hour before the expected time of the dressing. You can shave the area if necessary to remove the hairs. Removal of the adhesive is more painful if the hair is present. So the shaving should be done before the first dressing is applied. You can place the patient in a comfortable position and a relaxed position before, depending on the area to be dressed. Then give proper support to the body part of the patient. Give proper support to the body parts. If the patient has to be raised or hold in a particular position, that should be done. So if the patient has to raise and hold uh maybe the hand, or yes, whatever you want to dress, if the patient has to raise that part and hold it in position for a considerable time, then you can give support. Then see that the patient's room is in order with no unnecessary articles. Clear the bedside, the bed table, the over bed table, so that was there is sufficient space to set up your sterile field and arrange the needed supplies and equipment. Now you close the doors and windows to prevent drafts, put up the fan to avoid air current, adjust the height of the bed to a comfortable working of the doctor or the nurse, so that they have neither to stoop nor overreach to do the dressing. Remember that we talked about proper body mechanics. So bring the patient to a comfortable height, proper body mechanics, and you can bring the patient to the edge of the bed. You can call for assistance if necessary. So do the sterile procedure for you when you are trying to do the sterile dressing. That one will be helping with the sterile part. Then to transfer the sterile supplies and etc. That's what you need an assistant for. Then protect the bed with a smacking touch and a towel. Fold back the upper bedding towards the foot end of the bed, leaving a base blanket or a sheet over the patient. Then you expose the parts that is necessary. So you untie the bandage or the adhesive and remove them. That's the one they used to pack before. You remove the used dressing. Make sure that the dressing is not removed from its place until the nurse is ready to do the dressing. After washing her hands, then you turn the head of the patient to one side so that the patient may not see the wound or get worried about it. Now, this is, I would say it is personal, or it is by will or by choice. If the patient doesn't feel comfortable seeing his or her injury, you can turn it to one side and even create a barricade, like a screen. If it's a place that the patient cannot turn, let's say the patient is having injury on his side, there's no way you can, if you turn this way, it can be kind of this thing to him. Sorry about that. So like if you turn this way, it can be stressful. So you can just create a barricade in between the patient and the what and the injury site. So then after that, we move to the procedure and the steps involved in the procedure. So we won't be wasting more time here because we'll only be explaining part that needs to be explained because the procedures are quite explanatory. The first thing is to tie the mask. Now, why do we tie the mask? The reasons of is what? To prevent wound contamination with droplets. We've talked about that before. Use your mask, wash your hands thoroughly to prevent cross infection. Put on your gown to ensure that there is no sepsis, or that's to mention aseptic techniques. Then you open the sterile tray. Now, spread the sterile towel around the wound to create a sterile field around the injury. So you pick up a disinfecting forceps and remove the dressing and put it in the paper bag. Discard the disinfecting forceps in a bowl of lotion. So you don't the one you use the disinfecting forceps you use to remove a dirty dressing, you can't place it back on the wound on the clean dressing, or to lay you used to lay on that clean dressing. No. So when you remove that, you discard the disinfecting forceps that you use. So it won't traumatize the injury. Note the type and the amount of drainage present. Then ask the assistant to pour small amount of cleaning solution into the bowl. Purpose is to prevent contamination of the hands of the nurse by the outside of the bottle. So that's why I say you need an assistant. You are not touching the bottle. You are sterile. So your assistant is one point solution for you, doing everything that you need. Like you are only to hold sterile equipment against the sterile dressing. Like for the sterile dressing rather. Then you clean the wound from the center to the periphery, like we said, inside to the outside, discarding the used swabs after each stroke. So when you clean after each stroke, you discard. You don't clean. You clean that area, you come back to you clean again, use no, that's wrong. One stroke each. And the purpose is to what? Is to remove the purpose is to ensure that what uh the purpose is to ensure that the cleaning is being done from the cleanest area to the less clean area. And wound line is considered cleaner than the what? The surrounding area of the wound, even if the wound is infected. So after thoroughly cleaning the wound, you dry the wound with a dry swab using the same precautions, and you discard your forceps in the bowl of solution. Now, you've used a set of forceps towards to remove the dressing, another set of forceps towards to do the dressing to clean. Now, apply medications if you are ordered. And reason is to when you apply ointment directly to the wound, to apply ointment directly to the wound may be difficult. So apply a small portion on the dressing that goes directly over the wound. So then you can apply the sterile dressings now. After the wound is clean and dried, you now apply the sterile dressing. Apply the gauze pieces first, and then the cotton pads. Reinforce the dressing on the what dependent part where the drainage may collect. The reason is that cotton placed directly onto the wound will stick to the wound, so it's not done that way. When the discharge dries up, reinforcing the dressing will prevent oozing of the what drainage into the bed of the patient. Then you can remove your gloves and discard it into the bowl with the lotion. Then reasons for doing this is that gloves worn during the dressing might be highly contaminated. So you can secure your dressing with bandage or with your adhesive tapes. Now we'll be discussing the after care of patients and the articles. So the first thing we do is to help the patient to dress up and to take a comfortable position in the bed. You can change the garments if the patient's garment is soiled with the drainage. You can replace the bed linen also if they are soiled. Remove Macintosh and towel. Take all the articles to the utility room, discard the soiled dressings into the disposal covered containers, and send them for incineration. Remove the instruments and other articles that you put in disinfectant solution and clean them thoroughly, dry them and reset the tray and send them to for autoclaving. That's for sterilization. And replace all other articles to their proper what places. Send the soiled linen to the laundry bag for washing. You can remove the blood stains before sending them to washing. Then you can wash your hands, return to the bedside to assess the comfort of the patient. Now, special instructions in the care of the wound must be communicated to the patient. Then tidy up the bed, and the units of the patients. And finally, documentation, which is the most, of course, the most important part of our work, although not the most crucial. So I would say the most crucial, but not the most delicate. Of course, we've done successfully, we've been able to dress the patient's wound and maintaining aseptic techniques in the whole process. Now, if you don't document, how do you prove what you've done? So you record the procedure on the nurse's record with dates and time. Record the condition of the wound so that the type and the amount of damage, the condition of the sutures and everything, so that the next person taking over from you or the next person that will be doing the wound dressing, if it's not you, will know everything done for the patient, the progress of the injury, is the injury progressing or retrogressing, what has been done, or what will, is there need to be, is there need for emergency intervention on the wound? So all these things are needed to be recorded on ground so that what things like this can be put into consideration. Then on the nurse's record, on the nurse record, you record the date, the time, the type of wound, the status of the wound, and the signs you notice on the wound. Then report to the surgeon or the doctor if there's any abnormality that is found in the injury. And this is a picture example of what sterile dressing and sterile packing. Thank you for your time and listening. If you have any question, no one is here to ask a question right now. If you have any question, maybe you can just forward the questions so your questions can be answered. So I hope the video is explanatory. The video is explanatory enough, as well as the points they are quite explanatory. So the only part I think on my own end would be quite hard to process at a goal are the instruments and the procedure. So I advise us to go over it over and over it again. The more frequent you do something, the better you become at it. So we can just try, if some of us can afford these materials, you can just try get some of these materials. Even if you're not dressing a real wound, you can just get just practice something that looks like it. And for the instruments, please go online, browse the instruments, check the names, look at how most instruments are identified by their shape, by their clips, by the length, by their mouth. If you look at a needle holder, from a glance, you will know what you will notice the needle holder. If you see an action forceps, from a glance, you will know it's an action forceps. So most of these things are identifiable even from the look. Why some of them may look like each other that you may need to take a closer look. So we just have to go through all these things and get the best understanding we can get to be the best at what we do. Thank you very much. Have a wonderful day ahead.